Hi, I'm John Bermingham with the Board of Supervisors in Upper Mount Bethel, here with Dr. Raso.
Good afternoon.
Doctor, can you tell us the latest numbers for Northampton County and specifically Upper Mount Bethel?
Latest numbers in Northampton County are around 26,000. The death rate in Pennsylvania at this time is 23,500. Mount Bethel is 181. Bangor is 920, and Penargil is about 350.
Okay. So you think the numbers are heading down?
I think definitely the numbers are definitely heading down at this point.
Good.
And I'm not sure if it's just because of people getting vaccinated. We've had, I think, in the Lehigh Valley, an upwards of 20,000 people who have been vaccinated. And, you know, as long as there's more vaccine available, I'm sure that number will continue to rise. And I also think, you know, we believe that when we say the number of people who have the disease, that's really a microcosm of what's going on. We probably have 4 or 5 times as many who've actually had it and didn't know it.
Right.
So I think with the vaccine, people are still getting ill, not as much. We're moving towards herd immunity.
Good, good. When might the vaccines be coming to Upper Mount Bethel Township?
Well, I did get a notice from St. Luke's Hospital. At this point in time, they would like all the 75-year-olds in the area to contact their local doctor so their doctor can give their names and phone numbers and contact information to get to them so they can reach out and bring them in.
Okay.
Because a lot of people who are older just really can't deal with computers, or they missed a phone call, or they see a phone call and they don't want to answer it.
Yeah.
You know, they think it's kind of like spam.
Yeah, sure.
And I don't blame them. I see spam too. I don't want to answer it.
So your patients can call you.
The ones who are 75 and above, they can call me. We send their name down to St. Luke's,
Yep.
and they'll get them registered and get them in for their shots.
Okay, great.
And I think as once we get the 75-year-olds done, then we'll move down to the 65-year-olds, which will make everybody happy, including our township manager.
Good, good. Doctor, we hear the terms of contagious variants and strains of the coronavirus. What is the difference between a variant and a strain, and do the variants and strains make the vaccines less effective?
Well, there's basically 2 variant strains out there. It's still the same strain, but they have a slightly different genetic makeup, and one's from South Africa and one's from South America. What we're finding is that the 2 present shots that we have in the United States are effective. They're not as effective as with the primary SARS-2 virus, maybe 50 to 60% rather than 95.
Okay. So just building upon that South African variant, is there anything with the trajectory of the South African variant either globally or in the U.S.?
In the U.S., there's only been 13 cases.
Okay.
So it's not like we have a lot. And those people, they feel, have traveled from either Africa, or somebody from Africa had traveled here.
Yep.
So.
Okay, so also building upon that question, in terms of the South African variant, the UK variant, the Brazil variant, and I've read where there's up to maybe 7 variants in the US right now. Are these variants different in the types of transmissibility, severity of disease, and risk of death?
I think they're they're easier to get, so it's easier to transport, but
Yeah.
the death rate is basically the same.
Okay.
Yeah.
Okay. I've also done some research, and I saw that 230 million Americans would need the vaccine before we could get to herd immunity. How many people do you believe have received the vaccine so far?
Well, I think last week, 55 or 60 million have gotten it as of today, as of last week.
Okay. So we are getting there. We're getting closer.
We're getting there, but
immunity.
you have to remember that a lot of people already have some natural immunity because they had it.
Yeah, yeah. All across Europe, coronavirus vaccines are in scarce supply. But in France, they're surprisingly unwanted. And recent polls suggest 57% of France intends to get vaccinated, where in the UK, 89% want to get the vaccine. So with all this skepticism around the vaccines, do you believe the vaccines are safe in your opinion?
Well, like I've said previously, if you're above 40 years old, I think the 2-shot ones are are relatively very safe. If you're a young woman who wants to have children, I'd wait for the Johnson & Johnson.
Okay. And what are your thoughts about our limited supply of vaccines? Should we give one dose to everyone now and then wait for the second dose in order to reach more people, rather than giving a person 2 doses and then waiting till we move to the next category of people?
Well, I would say that, this is like math. If you give 1 dose of Moderna or the Pfizer shot, you're about 70% protected. If you have 2 doses, you get up to 95%. So I guess you really got to do the math. I mean, we do see that the numbers are decreasing. Our therapies for people who are quite ill work very good. I mean, some of the things I don't always agree with, because if you want to get the same shot that the president got, you have to be older, above 65, and obese. But that stuff's like a miracle shot, so why isn't everybody getting it when they are very ill? Clearly the Remdesivir works very good on it. It worked for me. So we have a lot of things in our armamentarium right now that really help. So I would say they could go with 1 shot and get to herd immunity a lot quicker.
Yeah, it seems like the logical step.
But I'm not Dr. Fauci.
You are Dr. Raso, and we're lucky to have you.
Yeah.
And how are you feeling these days?
I feel fine.
Good,
Thank you.
good. So now that we're at a point in time where cases, deaths, and hospitalization seem to be declining, what should we be thinking about when we hear these trends?
Well, we should be happy that we are getting, and clearly if you think back to last spring, as we got towards the summer month, it really decreased dramatically. So, and I think that will help us out a lot with getting these shots and the rollout. And the Johnson & Johnson will be the easiest shot to make because it's a single shot, it's made in eggs. It's a lot easier to make those than what we're doing now. So I would say we probably should be able to get everybody vaccinated by the summer.
That's great. And even with the Pfizer one, I read this week that it doesn't have to be in that cold refrigeration.
Yep, that's what they changed it already.
So that's great.
And they're also saying you can mix and match the shots.
Really?
If you got Moderna first, they're going to look and see if you can get the Pfizer next if they don't have it. Yeah, that's what they're doing.
Good. I have some resident questions.
Go ahead.
First one from a resident. Now there is discussion that wearing 2 masks might better protect us than 1 mask. Which is it? 1 mask, 2 masks, or no masks?
Well, depending on what state you're in. If you're in Florida, it's no mask, and they seem to be okay because I think they're outside. Here in the Northeast, where it's a lot colder, we're indoors a lot with each other, I think definitely 1 mask is definitely required. If you're susceptible to getting the disease and you don't really have an N95, or you just have a cloth mask, then 2 masks would be fine.
Okay. Next question. Do we have any idea yet of long-term effects of the coronavirus?
That is a great question. And speaking to a lot of physicians who are subspecialty physicians, such as cardiologists, pulmonologists, neurologists, they see a wide array of fascinating syndromes that go along with it, such as neuropathies, leg weakness, brain fog. A lot of people complain of brain fog. They feel they can't think like they used to. And of course, there's always the bad pulmonary embolisms, which seem to be popping up all over the place. So, there's definitely some things in the future we have to really watch out for.
Okay. Next question is, I have heard from a chief medical officer that people tend to be the most contagious with the coronavirus before they develop symptoms, if they're going to develop symptoms. When are people with the coronavirus most contagious?
I think they're most contagious probably about day 3 to day 14.
Okay. Do you recommend one vaccine over the other?
No, I do not.
Okay. What would you say to those who lack trust and confidence in the vaccines?
Well, a lot of people like to go play the slot machines, or they like to play the lottery. You got to take your own risk. If you feel that you cannot get this shot, you are taking a risk at not getting it. Do I think that in the long run it's going to be detrimental? No, I don't think that the government would make things to kill us. I do believe that.
Okay, great. Well, thank you, Doctor. As always, we appreciate your time.
You're welcome. Thank you.